Welcome to this short review of types 1 through 4 hypersensitivity. I'm Christopher, and in this final video, we'll compare the 4 hypersensitivity patterns and then work through a few quick quiz questions. The goal is not to just memorize the names, the goal is to recognize the mechanism. We all learn in different ways, so I've included this comparison in a couple of formats. One version organizes the hypersensitivity types by timing, clinical pattern, and examples. Another organizes them by mechanism, mediator, and target. These will also be available as PDF resources, so you don't need to memorize every cell of the table while watching. The goal is to use these as maps. These tables overlap a little, but they are doing slightly different jobs. One helps you recognize the pattern in a case. The other helps you explain the underlying immunologic mechanism. Now, we'll move on to a short quiz. There are 5 questions, and please feel free to pause the video after each question and take as much time as you need, or just sit back and think through the answer as we go. Question 1. Which hypersensitivity type is classically IgE and mast cell mediated? Feel free to pause if you need more time. The answer is type 1 hypersensitivity. When you see IgE, mast cells, rapid degranulation, and immediate mediator release, type 1 should move to the top of your list. Anaphylaxis is the severe systemic form, but type 1 can also include other immediate IgE and mast cell mediated reactions. Question 2. A patient develops localized swelling after a booster vaccination, followed later by alopecia at the injection site. Which mechanism best fits a local arthus type reaction? The answer is type 3 hypersensitivity. An arthus reaction is a localized type 3 reaction. Immune complexes form near the site of antigen exposure, activate complement, recruit inflammatory cells, and cause local tissue injury. Remember, arthus equals local immune complex disease. Question 3. Which hypersensitivity type is antibody-mediated and targets cell surface or tissue-bound antigens, such as red blood cells or platelets? What do you think? The answer is type 2 hypersensitivity. Type 2 reactions are mediated by IgG or IgM antibodies directed at the cell surface or tissue-bound targets. That is why examples include immune-mediated hemolytic anemia and immune-mediated thrombocytopenia. Question 4. Which hypersensitivity type is delayed, T-cell mediated, and may involve macrophage-rich granulomatous inflammation? What are your thoughts? The answer is type 4 hypersensitivity. Type 4 is delayed and cell-mediated. It's driven by sensitized T cells, cytokines, macrophage activation, and sometimes cytotoxic T cell injury. Remember the poison ivy example: delayed rash, T cell involvement, and contact dermatitis. Okay, last one, and you're doing great. Which hypersensitivity type involves soluble antigen-antibody complexes that circulate, deposit in tissues, and trigger complement-mediated inflammation? What do you think? The answer is type 3 hypersensitivity. Systemic type 3 disease occurs when immune complexes circulate and deposit into tissues such as vessel walls, joints, glomeruli, or skin. Examples include systemic lupus erythematosus and in horses, purpura hemorrhagica. The key phrase is immune complexes deposit and inflame. Nice work! You've now reviewed the major patterns for types 1 through 4 hypersensitivity. Remember, timing helps, but the mechanism decides the type. Type 1 is IgE and mast cells. Type 2 is antibody against cell surface or tissue-bound targets. Type 3 is immune complex deposition. Type 4 is delayed and T-cell mediated. Thanks for watching. I'm Christopher, and what you understand today helps you protect patients tomorrow.